Hi, I'm Dr. Ilana Galgut, and today I'd like to speak to you about a problem that I find really difficult to manage at work. As you well know, I'm a GP and a cosmetic physician, so I get people coming into me on a daily basis asking me to make them look younger, and therein lies the problem. We can't really make ourselves look younger. What we can do is definitely work towards achieving the best possible result. In other words, to make ourselves the very best version of ourselves that we can possibly be. Facial aging happens in actually quite a predictable manner, and we lose not just quality of elasticity and collagen in the skin, but we also actually lose bone mass. So in other words, the skull bones and the jawbone get smaller, as well as we have descent of some of the fat pads in the face. So the fat pad that starts out over here actually drops down, and the fat pad that starts out over here falls down to this area, creating the jowls, which most women of my age and older really hate. So going back to how do we achieve outcomes that look good and really do enhance the way you look, I think it's really important to understand that we need to be treated and addressed our aging concerns according to the age we are right now. We shouldn't be wanting to be treated the way someone of a much younger age would be managed. In other words, I'm 49. I don't want the same treatment that is suited to a 27-year-old. If I have the same treatments, I'm going to look particularly bizarre and strange. And what we know out there in the real world, there are many people spending lots of money, having multiple procedures, and they don't look quite right. There's really a fine line between, wow, you look good, to, oops, what has happened? And another really interesting thing is that your friends and family won't tell you when you look a little bit overdone, but what they will do is talk about you behind your back. Now, I really embrace the idea of people wanting to look the best they can for themselves, not to please someone else, but taking it to the extreme that you really don't care how anyone else thinks of you or whether they think you look strange. None of us want that. And going back to the classic of, oh my gosh, look at that lady's lips. The lips that really do look amazing on a 25-year-old or 27-year-old are not going to suit me. So if I want my lips enhanced, which I do have done, I need to address my lip area as not just the lip area. I've got to look above the lip as well as below the lip. This whole area in an older woman needs to be addressed. Otherwise, we end up with large, voluptuous, and firm lips sitting on a foundation that has lost bone volume, lost collagen, lost elasticity, and it just doesn't work. It looks strange. So what ends up happening is that the lip curls upwards. I don't know if you can see here. I have an area where I've actually lost volume. And if I firm my lips up, they're actually going to curve and crease in that area, and you can actually see that now that I've fiddled with the area, there's more of a prominent line and indentation. So it really is all about looking the best you can for the age you are right now today, and taking a generic look of doing cheeks or doing lips or Botoxing or disporting. It really needs to be age appropriate, and the treatment plan needs to be individualized and tailored to you right now where you are. So hopefully that's given you a bit of insight, and I'll be back to talk some more. Thanks.